Hello, my name is Nikki Smith, and this is my medication administration video for morphine for NE311-115. Here's my badge, and I'm going to scan my room. Okay, so the first thing I would do is I would make sure that I'm in an interruption-free zone. I would not take any cell phone calls, and I would also keep conversations to a limit. So what I'm going to do now is I'm going to take my patient care order form and compare it to my medication administration record form. So I have here, and morphine is on the back. So Jaguar J. Jones, medical record number 417-6352, medical record number 417-6352, allergies penicillin and allergies penicillin. And then morphine sulfate, 5 milligrams, IM, every 4 hours, PR in pain, and PR in pain. So all elements between these two documents match, and all elements of a legal prescription are there. So I'm going to take the patient care order form, and I'm going to set it to the side. So now I'm going to begin my first check of accuracy. So Jaguar J. Jones, morphine sulfate, and morphine sulfate is in this vial right here. Its expiration date is 12/20/2025. It is not expired, and 5 milligrams is what is ordered, and 10 milligrams per milliliter is what is in this vial. So I did a dosage calculation, and I got 0.5 milliliters. And anytime you do a dosage calculation, you must verify it with another nurse. It is an intramuscular injection, so I would need a 3 milliliter syringe, a blunt plastic cannula, and a 23 gauge needle. So I'm going to wash my hands. I'm going to get a alcohol prep pad, and I'm going to clean the top of the morphine vial. I'm going to discard of the alcohol prep pad. I'm going to get my 3 milliliter syringe. I'm not going to touch the tip, and I'm going to put on my blunt plastic cannula. Now I'm going to draw back 0.5 milliliters of air. Now I'm going to take the cap off and leave it where it is accessible, and I'm going to push in that 0.5 milliliters of air. I'm going to rotate, and I'm going to draw in 0.5 milliliters of air, not getting any air bubbles. Going to rotate here. Rotate down, going to take it out, and I'm going to put my hand behind my back and recap. So 0.5 milliliters of morphine. Okay. So this is a IM injection, so I'm going to twist off the blunt plastic cannula, put it in my sharps container, and I'm going to put on my 23 gauge needle. Okay. So now I'm going to complete my first check of accuracy if I have not already mentioned. So Jaguar J. Jones, morphine sulfate is what I put in my syringe. Morphine sulfate is what is in this vial. 5 milligrams, which gave me 0.5 milliliters for my dosage calculation, and 0.5 milliliters is what is in my syringe. It is an intramuscular injection. This is an appropriate needle length and an appropriate syringe for an intramuscular injection. It is given every 4 hours, and it has been 4 hours since Mr. Jaguar Jones has had morphine and PR in pain, and Mr. Jones is in pain, and all elements of a legal prescription are there. So this completes my first check of accuracy. So now moving to my second check of accuracy, I'm still in his chart. So Jaguar J. Jones, morphine sulfate is in this vial, morphine sulfate is what I put in this syringe, and what is in order. I have 0.5 milliliters. And it is an intramuscular injection. This is an appropriate needle length and an appropriate syringe for a intramuscular injection. It is given every 4 hours, and it has been 4 hours since Mr. Jones has had morphine. It is PR in pain, and Mr. Jones is in pain, and all elements of a legal prescription are there. So this completes my second check of accuracy. So I'm going to now label my syringe. So I'm going to grab a piece of tape, tear it off, and now I'm going to label. So Jaguar J. Jones, morphine is what is ordered, so morphine, and then I'm going to do 5 milligrams over 0.5 milliliters. So now I'm going to take that going to now label my syringe. Okay, it is labeled now. So Jaguar J. Jones, morphine is what is ordered, morphine is what is in this vial, and morphine is what is in this vial, morphine is what is in this syringe. I'm giving 0.5 milliliters. 0.5 milliliters is in the syringe. It is IM. This is an appropriate needle length and an appropriate syringe for an IM injection. It is given every 4 hours, and as previously mentioned, Mr. Jones has not had it in the past 4 hours. PR in pain, and he is in pain. And again, all elements of a legal prescription are there. Again, just double checking my second check of accuracy. So now I'm ready to go to Mr. Jones's room, since everything is good and labeled. So I'm going to grab my medication administration record, my syringe already in my hand, my vial, and I'm going to grab a alcohol swab, and I'm going to go to Mr. Jones's room. Hello, Mr. Jaguar Jones. I'm Nikki. I'm your nurse today. I'm going to be giving you your morphine injection for pain. Is that okay with you? All right. So first, I'm going to check your identification bands. So here they are. Okay. So looking in your record, Jaguar J. Jones, medical record number 4176352, medical record number 4176352, and allergies are penicillin and penicillin. So I see you're allergic to penicillin, Mr. Jones. Is there any other allergies I should be aware of? No? Okay, and I'm just going to do a brief assessment on you really quick. So I'm going to ask you on a scale of 1 to 10, 1 being the least amount of pain that you could be in, and 10 being the most amount of pain that you could be in. How would you rate your scale of pain? A 10? Okay, so I will document that, and I will also confirm that you are in fact in pain, and this is what this morphine is for. So thank you for letting me complete that assessment. So now I'm going to complete my third check of accuracy right here at the bedside. So Jaguar J. Jones is what I have on my label, and Jaguar J. Jones is on his wristband. Morphine sulfate is what is in this vial, and morphine sulfate is what is in this syringe. 0.5 milliliters is what is in my syringe. It is an intramuscular injection. This is an appropriate needle length and an appropriate syringe for an intramuscular injection. It is given every 4 hours, and it has been 4 hours since Mr. Jones has received morphine, PR in pain, and Mr. Jones is in pain as we just assessed. He rated it on a scale of 10. And all elements of a legal prescription are there. So this completes my third check of accuracy right here at the bedside. So now what I'm going to do is I'm going to wash my hands. I'm going to put my goggles on and put my gloves on. And this is a ventrogluteal injection, and I will demonstrate that after I remove my gloves. And ventrogluteal injections are intramuscular injections. So I'm going to take his ventrogluteal site right here. I'm going to take a alcohol pad, and I'm also going to assess for any bruising or any lesions or anything, and I do not see any signs of that, so he is good to get this injection. I'm going to take my alcohol swab, and I'm going to clean in a circular motion, not going over the same place that I just cleaned. Okay, I'm going to leave this right here. I'm going to take my syringe, and I will be holding it at a dart, and I will be going at a 90-degree angle since this is a intramuscular injection. So I'm going to take the cap off, going to put it in my sharps container. I'm going to spread the skin, and again going like a dart, and I'm going to go at a 90-degree angle. So 90-degree angle. Okay, since this is an intramuscular injection, I am going to aspirate a bit. I do not see any blood, so I'm going to slowly inject the morphine into his ventrogluteal site. Okay, it is all injected. I'm going to slowly remove. I would put the safety on, and I'm going to put it in the sharps container. We do not want any blood, so we're going to add pressure. How are you feeling, Mr. Jones? Are you feeling okay after I just gave you that injection? Good. Okay. So I applied pressure, so I'm going to discard of this alcohol pad. I'm going to now take off my gloves. I'm going to remove my goggles, and now I'm going to wash my hands, and I'm going to go to the nurse's station and document, and I'll be back in 15 minutes to check on you to make sure you are feeling good still and not having any allergic reactions to the morphine I just gave you, and I would reposition you for comfort, and just let me know if you need anything, okay? And for the ventrogluteal site, it would be located right here. I'd put the palm of my hand on the greater trochanter right here, and that's where I would give his injection, right here. So this completes my medication administration video for morphine. And again, here's my badge.